Welcome back inside the Now Morning Show, ladies and gentlemen. I hope that you guys have your tea, have your coffee, and you're getting ready to have a nice conversation and learn some more about what's going on across in Grenada. To do that, I want to welcome the Minister of Health in Grenada, the Honorable Nickolas Steele. Good morning to you, sir.
Good morning, good morning, good morning to you, and good morning to all of your viewers.
Thank you for taking the time to join us this morning. Can you give us an update as to what's going on in Grenada regards to COVID-19? You know, we had a recent surge in cases.
Yes, well, we've done spectacularly well up until August. We've managed to keep COVID out, no community spread, one cluster outbreak in December, and one death. And then we went from what we can only term as 0 to 0 in the space of 3 or 4 weeks. We now have 130 dead. We have 5,000 confirmed cases, 3,000 of which, however, have recovered. 1,795 at present active cases, 70 persons in hospitalization. So we have your typical Delta outbreak. It is our first wave. It is the first blow that our community has had, and it comes as a result of us, I would think, becoming complacent, being safe, and not taking the COVID protocols seriously as we should, and recognizing that COVID-19, especially the Delta variant, is totally unforgiving.
Minister, what would you say was responsible for the change in August in particular? Was it anything to do with the carnival celebrations?
In August, we do have our carnival, yes, and as much as we pass regulations making those type of gatherings illegal, we as a government were as tolerable as possible with our population, and as such, they were those gatherings. There was Juve, there was Jab.
Do you guys regret being so tolerable about it?
No, I don't think so. I think we have to respect the democracy. I do regret that we've had loss of life, but we are a democratically elected government, and if we cannot get our people to come along through persuasion and public education, then we have to deal with the consequences as a society.
How has the take of vaccines been? Has the country been taking vaccines?
There has been a surge in vaccinations as well. We are up to 23,000 persons of the 92 eligible. So that's fully vaccinated individuals. So there has been a surge, not enough, but a surge nonetheless.
What are some of the reasons that people haven't been taking the vaccine?
It's the same all around. It's the disinformation, misinformation that has caused vaccine hesitancy.
And do you guys have a plan to battle or combat that?
We keep pounding away. There is no excuse. We will not give up on our people. We will keep pounding away, and we will get through this.
Misinformation, or is it more that people are skeptical, and because their skepticism is being dismissed, people are refusing to listen to what the government is saying?
No, I didn't hear the first part, but I think I've got the gist of what you're saying with respect to the skepticism or so. It is disinformation and misinformation that has caused it. No, we're not being dismissive to these individuals. We are trying as best as possible consistently to educate them on the facts and the science behind it. But it's quite possible that the same thing is happening in Trinidad. There are individuals who are actively seeking to spread the disinformation, who I think are to be held accountable. And we need to recognize that. It is one thing to have your own personal belief, but it is another when you have individuals who are actively spreading to our vulnerable, and a lot of our people are vulnerable because people are dying. People are dying. This is a deadly disease, and it has created a level of anxiety that we have never seen before. Because we've spent 2 years dealing with and feeding this level of anxiety within our societies. And as such, we need to be cognizant of the fact that it exists. And we need to accept, but we need to bring to table individuals to have that discussion.
Right.
This is not like an election where you just need a simple majority to achieve your goal. We need 80 to 90% of our population involved. And as such, it takes our opposition, it takes our opponents, it takes our skeptics. We all have to be brought to table in order to succeed in this.
Minister Steele, what's the next step for the government in terms of battling COVID-19 in Grenada?
Well, for us, it is, we've got another week and a half of restricted movements. Within that week and a half, we need to analyze and see, and I think based on the current trends, and with the grace of God, we will be looking at some sort of easement and opening. It is to get more of our population vaccinated. It is to ensure that we don't have an extended wave or a new wave as best as possible.
Minister, you say that you guys are... You saying that
COVID.
You said that you guys are under a limited movement right now, yeah?
Yes.
And you're still seeing an upsurge in 130 cases yesterday alone. How?
No, we're not. That is a significant decrease. And yesterday, we are testing much more. We have what's referred to as no movement weekends. Basically, and it's only 83 positive cases yesterday out of all of the tests that we did. So no, it is not 130.
Minister, that's very interesting. But, are there any plans to have mandatory vaccines? Seeing that, I think you're saying the 20,000, people have been vaccinated thus far, but of 90,000, that's what, about a little bit under 20%?
Correct.
That in my mind is low considering the outbreak that Grenada is having. So is the government considering mandatory vaccines at all?
I think that the discussion and the public discourse on vaccines must be had, is being had and must be had. There are many who have been vaccinated, who were one of the first to be vaccinated, that are calling for a mandatory vaccination policy in order to bring others along. There are others who have held out, who have dug their feet in, who speak of rights, etc. And so the discussions must be had. It is going to be a difficult, as it is in Trinidad, as it is elsewhere, a difficult discussion, but a discussion nonetheless, it must be had and a solution must be found.
Well, I'm hoping you get to that solution because the government decided to go ahead with Carnival saying it's a democratic society. So are we going to be applying that same kind of logic to vaccination? No,
we did not go ahead with Carnival. I begged, I pleaded, the law was there, but we decided that we would not use tear gas and riot police against our population.
Yeah.
But a significant group, small but significant group, came out in defiance and said basically jab must play. And they have put us, the rest of us, at risk. And that is the cause. So it is not the government allowing, it is the government deciding what level of enforcement it will use against its own people.
So, Minister, I'm curious though, if it is that you're saying that as a result of the carnival activities and the jab playing and stuff like that, I imagine it was locals who came out in defiance, right? How did
Correct.
the Delta variant get into the society?
Look, there is no perfect quarantine system. You've seen it in Trinidad. Your borders were closed when you had your outbreak. Mm-hmm. So, and any public health official, I have consistently said, there is no perfection in border protection.
Yeah.
The longer you keep a quarantine period, the more people you have to have deal with individuals in quarantine, and the greater the chance of somebody breaching quarantine, etc. The shorter the quarantine period, there are those other risks that you may not pick up everyone at the right time.
Minister Steele,
a society, a community has to change its habits in order to prevent community spread.
And that largely depends on how the government is going to put across its messaging. But I'm curious as to how the government...
I disagree with you, my dear. One thing COVID-19 has taught us is that a government is not the one to save us. We have to save ourselves.
All right. I'm just curious because you spoke about this small group of but very significant group of people that decided that the jab must go on. And I'm figuring that you might have that small group who is also saying, let's not get vaccinated. And, you know, whatever their messaging might be. How does the government plan to combat that so that we don't end up with something similar, which is after that jab, we ended up with a spread, a rapid spread, a serious increase in COVID-19 cases? Because no matter what you say, Minister Steele, it comes down to the government to protect its people. And it's for the government to see if there's wrong messaging to combat that as well.
Well, I hear what you're saying with respect to the government to protect its people, and you are right there. With respect to wrong messaging, I think we need to recognize that in any democratic society, the messages in circulation are not only those from the government.
Yeah, that's correct. But how do you ensure that your messaging is the one that people decide to go home with and to take into consideration?
What I've been doing, and I think what we have had recently that has made a significant difference, is having the media on board fully as well.
Yeah.
And that engagement has made a difference. So it's not just dependent on me being on national TV or my messengers.
Yeah.
It is having all of our journalists, all of our media getting on board as best as possible and singing from the same hymn sheet. And that only comes with a recognition that the hymn sheet is the right hymn sheet. Because in any democratic society, you are going to have journalists that are deeply opposed to the government,
yeah,
but need to be aligned on a message. And that is what it takes. And sometimes it does take. It does take, like us, a wave. It does take, like I'm sure in Trinidad too, it does take having loved ones fall prey to and victims to COVID-19, that we all come together on this, recognizing that we have our differences on everything else.
Yeah.
But that we will find that unity on COVID-19, on vaccination, on following the protocols, etc.
Well, I'm really hoping so, because even in Trinidad and Tobago, as you say, after 1,400 plus deaths, we still have people who are saying COVID isn't real. But I think the strategy that Grenada has employed, and you as the Minister of Health, to engage the media to get the message across, I think that is really a solid and good move. And as you said, it has borne some fruit. And I hope it continues to bear fruit, and that Grenada will continue to see a decline in its cases and deaths, because we really want to see each and every island, you know, survive this and recover from this in the shortest possible time.
Yes, that is what we need to do. We're all in this together. But I think what we need to recognize that the message is clear. The message is science-based. The messengers are what we need to change sometimes.
Yeah.
All right. Well, Minister Steele, I want to thank you so much for joining us this morning inside the Now Morning Show, and all the best to you going forward, and the government and to the people of Grenada as well.
Thank you. Stay safe, and I hope to hear good things from Trinidad and Tobago as well.
All right. Take care.